Okay, today we're going to talk about the nurse's role in central line insertions and arterial line insertions. We're not going to go through the whole process of what the doctor does. We're just going to go through a little bit about what you need to do as a nurse. You hear that your patient's going to need some lines put in. You're going to go and start gathering equipment. We're going to start with the arterial line. The first thing you need to get set up is your pressure bag, which is usually just normal saline or LR, no heparin, a pressure bag, and we use here a triple transducer set. Don't even bother with the single transducer sets, because even if they say they're just going to have an art line, guaranteed they're going to put something else in. So just get your triple transducer set, and you can get it all set up and pump up the pressure bag and flush all your ports. Important things to make sure of is that you tighten all the connections and flush through all the caps. That's really important because you'll get a lot of air along the way, and that will affect your reading, so you don't want to do that. So tighten all your connections and flush through all your stopcocks, and there's 12,000 of them. This is the triple set that we use. When you open this up, there's one part that's in a sterile container, and this is to your arterial line. A lot of the doctors like this handed to them sterilely, so don't open this. Just wait for them to see how they would like this extension set to be handled. So that's what I do, because if you open this and they wanted it sterilely, then you're going to have to open another kit. Other items that you need, of course, your basics. Your mask, your caps, gowns, masks, and several drapes. We just use the disposable drapes. Some of them like the towel sets, but most of them are just fine with the drapes. The kits that we have the arterial line kit. We have just the arrow that'll show you. It's just the catheter. And then one of our doctors, Dr. H, she likes to just use this little 20 gauge IV too, as part of her insertion, but she also likes the kits. So what I do is I just gather everything. Just gather one of each. You have it all. You don't have to run around if you need anything else. You'll also need some lidocaine, so you have to get that out of the Omnicell. And you'll need some TB syringes. And I have a tendency to gather 2 of everything, because that way if you drop something, or if it's not good and he needs to do another one, then you have it right there. I also make sure that I have lots of gauze, because you'll just need it. And then you're set to go. The doctor he usually goes for the right radial a lot of the times, but you too can help out. You can find out which pulse is best, and then you can actually, even mark it for him or her. And what they like to do is just get a little towel roll and flex their wrist and tape their wrist to one of the side tables. And so he's all ready to go. Your patient's ready, the doctor's ready, and you don't have to mess around. And you'll also need, of course, your cepastat or whatever device or items that you use to clean the area. And that should be pretty much all you need for an art line. Once he inserts the art line, all you have to do is hand him that connector piece. If he's wanted it sterilely, open it up, give it to him. He'll actually hook it up, or he'll ask you. Oh, you're gonna have to cut that. He'll ask you to hook it to the arterial line transducer area and flush it really, really good before he hooks it up. Once he hooks it up, you make sure that your transducer cables are hooked up. Of course, red being arterial. And you will have you'll get your red line on the monitor, and you'll zero and calibrate everything to make sure that you have a good waveform. And that's basically it.